Well, we're here with Dr. Lee, a dentist in Mountain View, California. How are you doing, Dr. Lee?
I'm doing very good. How about yourself?
Not bad. Dr. Lee, I want to talk to you a little bit about your dental practice, as you know, and answer me a question. I mean, most dental practices they're not necessarily the same. So tell me a little bit, in your practice, what is your philosophy? What is your driving point of, with your patients, what you want to go after, the type of people you want, the type of people who come to you, what type of work are you doing? Because not every dentist does necessarily everything, even though us laymen believe that a dentist is a dentist is a dentist, but it's not quite true. And maybe even tell us what made you becoming a dentist.
Well, when I was a kid, my dad, he used to be a dental technician, and he still has his own dental lab. I used to go to his lab a lot and fiddle around with all the, cool little models and things of people's teeth. And, as I got older, I started to realize, I guess maybe from a young age, all that got very ingrained into me. And, dentistry really fascinated me. So that's pretty much how I decided how to become, that I wanted to become a dentist.
Interesting.
And, you're right. Yeah, you're right. Not every dentist does everything. Some dentists are content with just doing the very simple, basic treatments. In our practice, I really try to make sure that we get as much training as possible here in all aspects of dentistry. We do all the basic general dentistry, but we also do orthodontics, implants. We're starting to expand our practice into extensively treating temporomandibular disorders and sleep apnea. So, I believe that a dentist that's trained in a lot more fields can comprehensively evaluate the patient and know how to treat them better.
Right. It's a little bit like when you, number one, you get it done under one roof. And the treatment is more coordinated. And like with computers, you have hardware, you have software, you have networking. And if 3 different people do it all, everybody keeps pointing the finger at the other guy that it doesn't quite work.
Right.
And you eliminate that. Now, you said you do orthodontic. Are you doing also Invisalign?
Yes, we do both braces and Invisalign.
Wonderful. And you do obviously implants and all that stuff, and periodontal disease. You fix that stuff also?
Yes, we do.
Great. Well, wonderful. Well, what would you say as a short little message to patients out there, looking for a dentist, or just period in terms of their dental, oral health? What advice would you have for them?
It's really important that, all patients, all people, see their dentist regularly. A lot of people believe that, as long as they floss and brush every day, they'll be fine. But a lot of those problems happen because, even the people who brush and floss the best, they can't clean everything out. They're not aware of little problems around their teeth and gums, and those little things start to become really big. And when you go to the dentist and you have pain, well, that problem's just become a lot worse than it should be, and it could have been probably prevented a lot earlier. So a lot of it's just preventive maintenance rather than going in when you have a lot of pain. So if you have a car and you hear a little ticking, well, that's probably not good because, something's going bad already. If you took it to your mechanic for regular maintenance and they said, I noticed a little leaking here, maybe we should take care of it so later your engine doesn't have huge problems, because a huge problem might become really expensive.
Right. And can damage more stuff, obviously, which besides the money
Definitely.
Has an impact. Well, all right. Thank you very much, Dr. Lee, for being so candid with us and telling us how you became a dentist. Very interesting story.